Good morning and welcome to another week of United Way for Southeastern Michigan's What's the Word Wednesday, where we share important resources and have vibrant discussions about the topics that matter most to you. My name is Courtney Howe, and today we are joined by our partner Access to hear more about their behavioral health and substance abuse work. As we all know, mental health services have continued to come to the forefront of conversations about health in the past few years, and much has been done to destigmatize seeking support for mental health and substance abuse support. Access has served the community with mental and behavioral health services for many years, but has recently committed to increasing those services through a new behavioral health center in Dearborn, which is super exciting. Here with us today is Lenny Panisi, a behavioral health coordinator at Access. Lenny is going to share more with us today about the work of Access in this field, as well as how the organization is working to further address mental health services in marginalized communities, such as the Arab American community. Access provides a comprehensive list of services, including outpatient mental health and substance abuse treatment that is culturally sensitive, accessible, and inclusive, allowing transformational growth to occur within the communities they serve. A few reminders for today's discussion. We will take questions from the audience, so please put your questions in the chat box on Zoom or in the comment section if you're watching on Facebook. Closed captions are enabled in Zoom and Facebook Live. To turn them on, please click on the Show Captions button at the bottom of your screen. I'd like to share a bit more about today's guest. Lenny is a behavioral health coordinator at Access and has been with the organization for more than 4 years. His role at Access is to provide clinical social work interventions for outpatient mental health and substance use treatment. Lenny graduated from Michigan State University with a master's degree in social work. As a social worker, Lenny shares that he values working and living in the community he serves. He is passionate about creating space for his clients and the community to share diversity of opinions, culture, and conversations, and providing culturally sensitive mental health and substance abuse treatments. Lenny, welcome and thank you so much for being here with us today.
Yeah, thank you, Courtney, for having me, and I'm happy to share about the services we have at Access. We've been providing behavioral health and substance use services for years now. The organization has been open since 1971, so this is its 52nd year in operation. Some of the mental health services we do provide are individual counseling, family counseling, and group therapy, as well as substance use services. Some of our goals regarding mental health services are to increase awareness of mental health disparities within the Arab American community, to decrease stigma, like you mentioned, with mental health and substance use services, and to increase the availability of mental health services in the Dearborn and Wayne County community. We are a community mental health agency. So a lot of our referrals are through Detroit Wayne Integrated Health Network. But we also have grants that cover uninsured and underinsured clients. So we don't turn anyone away. So if anyone is seeking mental health or substance use services, we will be able to provide those services for you. Some other services we have is peer recovery coaches, as well as outpatient psychiatric services. And then we also have a list of specialty programs within our mental health program. We do have a survivors of torture program, which is clients who have been exposed to violence or torture in their country of origin, but now are here in the United States. Another specialty program in our mental health program is the Survivors of Violence Empowerment Program. So that is for anyone who's been a victim of crime. And then we also have a Child and Adolescent Health Center, which provides mental health services and substance use prevention services for children and adolescents in the community. Another program to address substance abuse is our Access Substance Abuse Prevention Program. So they have been ramping up their services lately in regards to opening our substance use treatment center, which will be open within the next couple of years. So their goals are just to bring awareness and address stigma related to substance use within the community. Their mission is to empower community members to support a drug-free community, as well as education, advocacy, training, and research regarding substance use. Substance use prevention program is dedicated to linking community members to our mental health services that we provide. Some things they do is reduce accessibility and use of substances. They do have a school-based program for prevention services. And we do have a quick response substance use team, which is partnered with the Dearborn Police Department. So anyone who has questions about substance use can call that number and kind of get a quick response team to prevent overdose deaths, to administer Narcan. So really a rapid response to substance use. So our goal at Access is to provide, a holistic approach to both mental health and substance use treatment. Yeah, and I'm open to questions, answers, any feedback.
Absolutely. Well, Lenny, we thank you for, the overview of what Access does. I know at the beginning of the pandemic, Access was providing COVID vaccinations, and I was one of them. So I appreciate, you all, and I know you all serve the community very well. So again, I thank you all for that. One of the questions that we have is, what is Access seeing in the Arab American community and possibly also recent immigrant communities in terms of needs for behavioral health and substance abuse services?
Yeah, I mean, I would say the needs of the Arab American community mirrors the needs of the general population, right? There's going to be mental health within any population. As we know, mental health doesn't kind of pick and choose who it affects. So the needs of the Arab American community are similar to the general population. There is going to be serious mental illness. There's going to be serious substance use as well. I think one of the things is breaking the stigma of addressing it and saying there is a need for it. A lot of it is cultural, where the shame comes into play.
Mm-hmm.
One thing that we are doing on the national level with the NNAC team, so the National Network of Arab American Communities, is we are working with the Office of Management and Budget to provide public comment on like the MENA category, so Middle Eastern, North African. So if that is included within the census, then we can get better statistics on how the Arab American community with the MENA category is being affected by mental health, substance use, and then we can get more federal funding to address those concerns. Because right now we're just playing it by ear of like, what are the numbers? Because we can't get the real numbers.
I'm glad you mentioned stigma. That was another question that we had for you. We know that the pandemic broke down a lot of barriers about the importance of mental health, but there's still a stigma that, that we have in our communities. What do we need to continue to make it feel more safe and normal for people to access mental health and substance abuse services?
Yeah, I think one thing is to create environments to have those conversations, and it doesn't always have to be in the typical setting we think about, like in an office building at our doctor appointment. Sometimes that's very hard to like bring up things when you're like in a closed setting rather than an environment that kind of creates discussion and conversation. So what we do is we do a lot of home visits. We do a lot of community visits where we're out in the community or out in homes where you can have those conversations more comfortably.
That's really important. I think those home visits are key. And again, creating those safe spaces for people to, utilize their voice and feel comfortable sharing, being vulnerable at that moment. So That's wonderful. One of the questions we have in the chat, can you tell us more about why Access decided to open a new behavioral health center, and what services will that center provide?
So the center that is opening is going to be specifically substance use treatment, actually, not behavioral health. So it'll be a substance use treatment center. We decided to open it because we saw, I think as everyone has seen with the opiate epidemic, with the amount of overdose deaths. I was looking at this morning, just the numbers in the past recent years in the state of Michigan. It's been steadily increasing. I think the past year was 1,700, then 2,000, and then we're still waiting for the final numbers in 2022 of overdose deaths. But it seems like there is a trend upward. So we did open it because we know that we know there's an opiate epidemic. We know that clients specifically in this community need substance use treatment. And we have run into issues of access, right? So we have clients come in who say, I need, inpatient care, and that wait time, hinders on their treatment. So we kind of decided to take it, on the forefront of saying we need to provide the service if we are seeing the demand of it in the community.
Wonderful. Thank you for that. We're really excited to, be able to have access to this new building and facility and utilize these services. So thank you so much for that. Access has been running campaigns to address myths about the usage of common substances like vapes and hookahs. Can you talk a little bit about why this was necessary?
I think it's necessary, going back to stigma, right? And also just education, right? Anytime you have more education and knowledge, then you can kind of make an informed decision about, what you are, putting in your body, what are you inhaling, what activities are you interacting with, specifically vaping, hookah, even tobacco, right? Even smoking. We're trying to bring that up in our education prevention as well.
What risks have you all seen with hookah and vaping that you all have seen in the MENA community or in our community period regarding those substances?
I think the risk is we know, the research is there, vaping and hookah, it's more dangerous than smoking a cigarette, right? So it's leading to the same, lung damage that tobacco and smoking does as well. So it's just kind of educating to realize that there is really no safe way to inhale cancerous materials, right?
True. That's very true. Thank you for sharing that. Another question in the chat that we have, Lenny you mentioned that about the opiate epidemic. What can people in the community do to support efforts to help people who are suffering from opioid addiction, whether it's the family member, friend, or stranger?
Yeah, my advice would be research Narcan. So we do have, if a family member, friend, or community member or stranger is using substances, specifically opiates, kind of do some research on Narcan. It's federally available. The FDA did just pass where it will be over the counter, which is good. Harm reduction access for it. So research that, because that's, your first form of safety, right? If a friend, family member, stranger is having an overdose, we want to prevent that death, and that is the best way to prevent that death. And then, start with having a conversation with them, start with having discussion about, treatment, whether that's mental health and substance use treatment combined. But I would definitely educate and research about Narcan, how you can access it. You can access it at Access. Access does offer Narcan training through our Access substance abuse prevention program. And all that information can be found on our website. And you can always reach out to me if you need kind of like when we're doing the next training. And we also do it in community settings as well, not just within our building.
Wonderful. Thank you for sharing that information, especially the information on Narcan training. So thank you for that. You spoke about the importance of cultural sensitivity in your work. Can you share more about about how you approach helping people differently to that point?
Yeah, definitely. So as a social worker, obviously it's very important to provide cultural sensitivity clinical work. So how I approach and how we approach at Access is we do have a diverse workforce, which is important because, when you're receiving services, you want someone that similar background to you, that looks like you, that maybe has similar beliefs as you, just to be comfortable and to get the treatment that they deserve. So we do have a diverse workforce that kind of represents the Wayne County community, so the community we serve, as well as we do have an office in Macomb County as well that provides mental health and substance use services. So that's one way that Access is addressing that.
Wonderful. And what do you see as the most important thing anyone can do to support their own mental health and their mental health status?
I think the one thing anyone can do to support their own mental health is to, don't be afraid of therapy, right? It's not a scary thing. And then also kind of being gentle and kind to yourself, right? It's okay to, ask for help. It's okay to slow down, especially within, getting out of a pandemic. Like we were very fast paced. It's okay to slow down and kind of recognizing the losses we had during the pandemic, whether that was death of family members or friends, losses of economic opportunities like jobs, losses of community, losses of spaces we had. It's okay to acknowledge that and slow down as well.
I absolutely agree. I think too with the pandemic, a lot of us have not given ourselves time to detach or to
Mhm.
really process the past 3+
Yeah.
years. And we just really have to give ourselves grace, whether it's in
Mhm.
the workplace, whether it's with our families, with our friends, our social lives. So
Yeah.
that is very important. And again, therapy and again, just detaching and making time for yourself. That is so important. So thank you
Mhm.
for that.
Yeah.
Thank you for that. Another question that we have, did you see a rise in mental health services needs during the pandemic? Has that died down at all?
Yes, we definitely saw a rise in mental health service needs during the pandemic. I would say before the pandemic was like a straight line, then increase, and now it's kind of going a straight line again. But I think the demand for mental health services will always be there. I think um, due to the nature of the pandemic, it led to isolation, it led to loss, so it led to grief, right? Grief counseling. So there definitely was a rise to it, as well as, it just brought new stressors to our everyday lives that weren't there before. Anxiety about getting sick, anxiety about infecting someone else, anxiety about, what activities we can and can't do. So that does, with that stressor, it's going to increase kind of the symptoms of mental health diagnoses.
That's been very important. Thank you for that. And before you mentioned, I know you all have your new building that you all have
Mm,
opened and you have multiple locations. Do your different locations have different services specifically? So I know we have
yep.
viewers from all Oakland County, Macomb County, and Wayne County, but can
Mm,
you talk about what the differences are per location?
definitely. So I'll start with our Macomb County, that's in Sterling Heights on 14 Mile Road. So they provide WIC services, so women, infant, children. They have a medical clinic. They provide harm reduction and they have a safe syringe program as well. So a lot of harm reduction and drug substance use services. They also have a mental health program. So that's outpatient mental health and substance use services. So that's our Macomb County location. And then we have 3 locations in Dearborn. The location I'm in right now is our Schaefer building. So that provides outpatient mental health and substance use services. And then right across the parking lot is our Maple location. So in our Maple location in Dearborn, we have medical clinic, we have WIC, we have a couple of the specialty programs. So survivors of torture, survivors of violence empowerment program, as well as harm reduction and safe syringe service as well. And STD and STI prevention services. And then we have our main headquarters, which is where our kind of youth and education is located. We do also have social services at both the Dearborn locations as well.
That's extremely helpful. I know as we're concluding and wrapping up this conversation, I wanted to just ask you again, how can people who will need services from Access, how can they access you and
Mhm.
get in contact with you and the organization to get these services?
Yeah. So like I mentioned before, we are a community mental health agency. So if a client has Medicaid, their best point of access is through Detroit Wayne Integrated Health Network. So that's by calling their intake access number. And that number is 800-241-4949. If anyone needs assistance with calling that number, they can come in, walk in, we can help them make that call and have that conversation with them and help them make that phone call over the phone. So come to our Dearborn Schaefer location if you need help with that. You You can also contact our just general mental health intake line, which is 313-945-8138. Or also calling our Macomb office, and that number is on our website as well. But yeah, we don't want to prevent services, so feel free to walk in if you have questions, if you need help with accessing services. Like I said, we do provide services for anyone who is also uninsured or underinsured as well as private insurances.
That is extremely important too. And thank you for sharing that tidbit. I was not aware of that, but that's extremely, it's a huge need in our community,
Yeah.
serving those who are uninsured or underinsured. So I appreciate that. And for everyone who is watching right now, you can find those websites and other resources in the chat functions. So at this time, Lenny, I really thank you for sharing so much about this topic, about mental health, even with access to resources. So I really, really appreciate that. Thank you so much for joining us today.
Thank you for having me, Courtney.
Absolutely. And before we close, I have a few more updates for our audience. Are you ready to rise to the challenge? United Way's third annual Equity Challenge begins May 16th and will conclude 21 new days of engaging content, as well as opportunities to connect with your neighbors about equity issues that matter. The Equity Challenge is free, so sign up today at unitedwaysem.org/equity challenge. And again, that is from May 16th to June, I want to say 17th, to June 17th. So again, 21 days for the 21-day Equity Challenge. As a reminder, for anyone in our community who may be experiencing a need, our 211 helpline remains available 24 hours a day, 7 days a week. This includes resources like food, utility assistance, tax assistance, and much more. We always maintain a running list of available services in the community, and it can connect you to the support that you need. You can also look up resources in your area by using our 211 resource database at unitedwaysem.org/211. April is Global Volunteer Month. If you're looking for opportunities to get involved in the community, United Way's volunteer portal can help. Search for volunteer opportunities that best match your abilities, needs, and interests. You can even set up alerts for the types of volunteer projects or organizations you care about the most. Visit unitedwaysem.org/volunteer to get started. In conjunction with our Equity Challenge, we're excited to bring you a series of equity-focused town halls in May and June. Look for updates on those topics and speakers in the next few weeks. To stay updated on our upcoming topics and watch replays of previous town halls, please visit unitedwaysem.org/virtual town halls. Thank you, everyone. We will see you soon. Stay safe and continue to live united. Thank you.